My biggest fear is an active shooter situation occurring in one of our ERs.
Officers at New York City Health and Hospitals are known as New York's Courageous, and they're tasked to protect patients, hospital staff, and visitors who walk through the doors of the emergency room. But these days, they're scared for their own lives.
I don't have a vest. I don't have anything to protect me.
They also fear retaliation from the city for speaking out. That's why we're concealing their identities. The over 800 law enforcement officers carry batons, handcuffs, radios, and flashlights while working in the city's 11 hospitals. But some tell Pix 11, since the deadly shooting inside of Bronx Lebanon Hospital back in 2017, they've been fighting for more gear and training from the city.
Our policy is to help and ensure the safety of the patients and staff.
Earlier this year, 13 hospitals on Long Island armed their security guards, some who are retired cops, with guns. From escorting prisoners to interacting with people who have mental health illnesses every day, hospital police here in the city say there have been multiple times where they thought they weren't going to make it back home to their families.
A gentleman just walked in to one of the main lobby, and he said he wanted to report a murder, and he said that he was the killer. He came back with a double-barrel shotgun. When there was a K2 epidemic, we had patients, many patients coming in K2 affected, and their actions was uncontrollable.
What's your biggest fear?
Not going back home the same way I came in.
A spokesperson for New York City Health and Hospitals tells Pix 11 the current training that's given to their officers complies with the New York State Division of Criminal Justice Services Peace Offer curriculum. Still, these officers say beyond their badges and batons, they feel helpless and at the very least should be given vests and tasers.
I feel very vulnerable. I'm scared for my life.
And we did also ask the city if they plan on adding any new active shooter training for the officers or equipping them with more gear like vests. We have not heard back from them just yet on that one. This conversation is one, of course, that we will continue to follow for the safety of all New Yorkers. Tamsen and Corey.